Our project is focused on mental illnesses. We mainly want to focus on getting better treatment for prisoners with mental illnesses. A side focus we have is getting better awareness.
Let's first start off with an education of mental illness.
50% of mental health conditions begin by age 14. 1 in 4 adults experience a mental health condition every year. Taking the mental health of young people seriously can help prevent the situation from becoming severe. ADHD, anxiety disorders, autism, bipolar disorders, BPD, depression, eating disorders, OCD, PTSD, and schizophrenia are all mental illnesses. Treatment and support are required to make sufferers' lives better. Children differ from adults because they experience many physical, mental, and emotional changes in their life during natural growth and development. Let's start by learning about 6 different types of mental illnesses.
Anxiety disorder is when people respond to certain things with fear or dread and with physical signs of nervousness.
ADHD is when people have problems paying attention or concentrating. They can't seem to follow directions and are easily bored or frustrated with tasks, and they are constantly moving and impulsive.
Eating disorders occur when people have intense emotions and attitudes, unusual behaviors associated with weight or food.
Learning and communication disorders are when people have problems storing and processing information and relating to their thoughts and ideas.
Tic disorders cause a person to perform repeated, sudden, involuntary, and often meaningless movements and sounds.
Schizophrenia causes someone to have distorted thoughts and perceptions. Let's take a look at how Connecticut handles mental illnesses.
Valley Hospital holds 604 mentally ill individuals publicly opened for the mentally ill. It initially opened in 1868 as the state's public hospital for the treatment of persons with mental illness, according to the Department of Mental Health and Addiction Services. Currently, CVH is comprised of 28 inpatient units over 2 campuses in Hartford and Middletown. Now CVH is open for recovery and wellness programs for the mentally ill and those suffering from addictions.
What is your occupation?
I'm the Vice President of Community Support Services for Marrakesh.
What do you think is the most important problem regarding mental illness?
I think the biggest problem regarding mental illness is access to services. I don't think there's enough information in the community for people who have mental illness to get help.
Does the company you work for deal with mentally ill people who have committed crimes?
Yes.
How does your company handle these situations?
Normally we work with the probation officer and possibly a social worker with Department of Mental Health and Addiction Services, and we work in collaboration with them to get the assistance that the person with mental illness needs and to help reintroduce them into the community.
Do you think people with mental illnesses should be allowed to be in solitary confinement?
I think it depends on the diagnosis and what type of mental illness they have.
Do you think mentally ill people should be treated differently in prisons?
So again, I think it depends on their diagnosis and the type of mental illness that they have.
Do police officers and prison staff need to change their training and/or actions on the job so things can change for the mentally ill?
Yes, I think all professionals, teachers, police officers, firemen, anybody that works with the community needs to have better information and education on mental illness.
A corrections officer commented about prisons becoming the new mentally ill health providers. One of Connecticut's mental hospitals shut down while holding 4,000 patients. Having mentally ill prisoners is expensive. People with mental illness are overrepresented in the justice system. With proper treatment, many of the incarcerations could have been prevented. Mentally ill people are put into prison due to minor crimes. Bob Berenstein, the executive director of the Basbagill Center for Mental Health Law, says the lack of community health services is the reason for high rates of mentally ill prisoners. Treatment centers have had to cut services and turn away patients. More people with severe mental illnesses are in prisons than in hospitals. People with mental illnesses are sent to jail instead of hospitals while pending trial. According to the Bureau of Justice Statistics, most mentally ill inmates don't receive treatment. Psychological experts talk about the extreme vulnerability for children to have developmental harm and mental deterioration in prison. Most go through depression, hallucinations, and self-harm while in solitary confinement.
In Connecticut, there are 14 prisons. The Garner Prison accepts only mentally ill prisoners. The Garner Prison holds 640 mentally ill prisoners. Many states have prisons for mentally ill individuals instead of hospitals. Connecticut DOC is responsible for all prisoners in the state. Connecticut DOC allows involuntary administration of medication in a non-emergency situation. 1 year, Harper sued the state of Washington for making him take antipsychotic drugs. Courts ruled that the prisons need proof to make a prisoner take antipsychotic drugs. Now to give medication, they have to go through a Washington v. Harper proceeding with a psychiatrist, health services staff person, and a patient advocate. The panel must agree that medication is needed to help the person's mental condition. If the panel doesn't agree, then it gets sent to the Mental Health and Psychiatric Services Director for review. In 2006, the Bureau of Justice Statistics discovered that half of prison inmates are mentally ill.
In 2011, 18% of Connecticut's prison population was taking medicine for mental illness. The amount of mentally ill people in jail contributes to prison overcrowding. Judges and prosecutors are sending mentally ill people to prison because there's nowhere else to put them. In Connecticut, the cost of a mentally ill prisoner is 2.5 times the cost of a healthy prisoner. Mentally ill people who go to prison are double the cost of mentally ill people who do not go to treatment. Connecticut officials think they can save money by not treating the mentally ill individuals. $4.35 billion have been cut from funding for mental health.
New York City's Rikers Island Jail deals with mentally ill teenagers by putting them in solitary confinement. Disciplinary segregation is another term for solitary confinement. Rikers holds hundreds of adolescent prisoners a day in solitary confinement. 3 of the teenagers who have been placed in solitary confinement at Rikers have been in solitary for over 200 days. They suffer from serious mental illnesses, and their dads have been in prison. A fourth of teen prisoners are held in solitary confinement each day at Rikers, and 71% of them have mental illnesses. Suicide is a bigger risk in solitary confinement than it is in the general prison population. Suicide is the #1 cause of death among inmates. Now let's see some real-life stories about mentally ill people in prisons.
New York Board of Correction is making new rules for solitary confinement at Rikers. They hope to decrease the amount of long-term damage to teen prisoners. The plan is to ban solitary confinement for children and teen prisoners, limit amount of time in solitary confinement, monitor the length of it, and must be reason stated for the use of solitary confinement. New York City Department of Correction is part of a growing trend to limit solitary confinement. Colorado, Mississippi, Illinois, Maine, and New York have plans to reduce time in solitary confinement. The reasons are surrounding financial, safety, and humanitarian concerns. U.S. Immigration and Customs Enforcement has already limited the use of solitary confinement in immigration facilities.
Armando Cruz killed himself while in a California state prison in Sacramento after having a history of mental illness. They put him in solitary confinement. Cruz's mom tried to get him the right kind of care, but the first doctor refused to give him medication. The first doctor said Cruz got in trouble because of drugs and his friends. Other doctors gave him medicine that left him catatonic. Cruz went to jail for attacking a police officer. Cruz's mom thinks that her son is innocent and that the real perpetrators are the voices in his head that made him confess. Matthew is an inmate at Rikers. Matthew has bipolar disorder and a drug addiction. While waiting for his trial, he got into a fight with a guard. Matthew got sent to solitary confinement for 250 days. He was alone for 23 hours a day. He was not able to go to school. I talked to myself, Matthew said of his daily life. This is crazy. I really feel like I'm bugging out in that cell.
A lot of mentally ill people are in prison. Some do not get the proper treatment. With our law that we are proposing, we hope to get them the proper treatment to let them live healthier lives. In Connecticut, we have 14 prisons, of which the mentally ill are not treated with the best care.
We believe the reason why mentally ill people are put into jail is because society isn't educated enough about mental illness. Our law would also help people become more aware about mental illnesses. Our main focus is on getting the mentally ill people the proper treatment to decrease the amount of prisoners with mental illness.